Hi everyone, my name is Richard. Today I will be demonstrating body psychotherapy techniques. The first one will be rolling, the second one will be hitting, and the third one will be release or discharge. Each technique is utilized to bring the client into their bodies, to connect them to their bodies, their sensations, and each exercise focuses on the breath while doing them and remaining grounded, feeling their feet, which kind of altogether works to um, initiate the parasympathetic nervous system and bring calm to the body while also allowing the client to experience the sensations that arise in a safe, controlled environment at their pace. So, if we're going to work with the client when it comes to body psychotherapy, sometimes when they come in, it's a good idea to, obviously this is all based on their willingness and their comfortability level. Um, but they could be stressed out about a lot of things and kind of in their mind and thinking and thinking. And one way to help them, be available in the session or to be present for the session is to somehow help them get in touch with their body. And I think a roller can be used in an effective way to do that. So what we can have them do is I got this on Amazon, by the way. It's a pretty big roller. What it does, it expands the chest area. And when we're on it, we want the client to breathe deeply and basically, open this area, which is a lot of times the client will come in. Again, sorry about the video. They'll come in and they'll kind of be, collapsed. You can kind of read from their body language that they don't have access to much energy, um, depression, um, whatever words you want to use. Um, we're trying to basically bring energy back into their body so that we can actually have a session of work with them. So with the roller, what we want to do is have them lay, starting, in the neck area, and put their arms behind their head and just slowly roll while they're breathing. So you want to take deep breaths into the nose and then out through the mouth while they're rolling. And just ask them to roll back down to the waist while they're breathing, and then back this way. And then what we can also do is once they hit a certain point in their mid back, we can have them sit like there so they get a good extension in the chest heart area and just let that be open while they breathe. And let them know that it's okay to make some noise on the exhales. Uh, whatever noise comes to them. Ah, ah. And again, this is basically to get them in touch with their body by doing some rolling. Okay? And then obviously it depends also on the physical capabilities of the client. Working with somebody that can't, lay down and get onto a roller, then we will need to use other methods as far as getting them in touch with their body. So I'm going to put that here. Again, so when a client walks in, let me see if I can raise this a little bit. So when a client walks into the office, you basically see their posture as being, somewhat collapsed, um, head down, shoulders forward. You can kind of tell that their energy is low by seeing, just, looking at them. Um, it's hard to have a session with someone like that because um, they're not really present. They don't really feel themselves. So another way that we can help them, what I call is charge their body, basically get some energy flowing into it so that we can work with them, is we can do some hitting. So I have a yellow whippable bat. I have a pillow here on the table, and what you want to have the client do is put their feet steady on the ground, bend their knees a little, and what you're going to want them to do is you can use any buzzword that kind of resonates with the client, whether it's no, um, maybe they're experiencing an overwhelming feeling in their life or something going on where they feel like they have too much on their plate. So we can say things like back off. And you can work with the client while they're doing this to see what word or what phrase may resonate. So if they could start with like, and what you want them to do is really feel it in their midsection as they're saying that word. So, and they can, and you want them to pick up the pace while also remaining grounded. So it could look something like this. And as I'm doing this, I'm feeling more energy coming through my body from the ground up. Or it could be something like back off. Okay. So again, what we're trying to do is help the client feel present in their body by helping them experience sensations. So right now, I feel my heart beating from doing that. I feel my feet on the ground. I feel my arms. I feel my body. I'm in my body, and my breathing's a little shallower because I'm expending energy at the same time. And then, so what we want to do with that charge is we basically want the client to be in control of what's happening. So they're the ones hitting, energy's flowing into their body. They're in control now of what they're doing. So they're bringing those feelings into their experience. And then we want to have them sit with that for a while. Sorry, I had to move up. I saw the time was going a little too over, so jumping into what we do after hitting when the client's body's charged. We want to teach them or show them how they can ground that energy. So what we want to do is have them put their feet about shoulder width apart, a little bit closer actually. Bend their knees a little, and what we want to do is just kind of like a waterfall pose. Come down, just hang and breathe. And that's, there you go. While they're down there, what we can do with consent, of course, before we touch a client, obviously, we put a little pressure behind their earlobe on their neck right here. As they're doing this, to stimulate the vagus nerve, which activates the parasympathetic nervous system, helping to ground, calm, and promote balance in the body. And so after a couple minutes of that, you want to have them come up, and their head's going to be the last thing. Slowly, and have kind of just shake off any excess energy, and then ask them how they feel. A lot of times they feel more here in the present moment. And that was our goal. Thank you.